Hello everyone, how are you? Welcome back to my channel, Scan360. Today I will talk about the basic MRI sequences done in case of brain MRI. Here we can see this is MRI of brain of a male patient about 23 years old. Here we can see this is the T1-weighted image. How we can understand that this is T1-weighted? In case of T1-weighted image, here we can see these are the ventricles. Inside the ventricle there is fluid. So in T1-weighted sequence, the fluids are black here. And here we can see this is the brain parenchyma. Here is the white matter and here is the gray matter. So in the gray matters are grayish here and the white matters are hyperintense, that is whitish. So we can say that this one is the T1-weighted sequence, and in this sequence we usually look for anatomical structures. And then one important other sequence is called T2-weighted sequence. We will see now T2-weighted sequence. Here we can see this is T2-weighted sequence. Here the ventricles containing CSF, that is fluid, it's hyperintense here, it's bright here, and also the white matters are black here and the gray matters are hyperintense here. That is the gray matters are brighter than the white matter. So this sequence is T2-weighted sequence. Now we will look for other important sequence done in case of brain MRI. This one is the FLAIR sequence. This FLAIR is similar to T2, but the CSF is suppressed here. Here we can see within the ventricles the CSF is signal void here. That is, the signal of the CSF is suppressed here, and thus we get the FLAIR sequence. It looks like T2. How we can understand that this is FLAIR? In case of T2-weighted, we have seen that the gray matter was hyperintense and the white matters are darker than the gray matter. So the parenchyma looks like T2 sequence, but the CSF is signal void here. So this one is the FLAIR sequence. Some other important sequences are, this one is the susceptibility weighted image. This one is done to assess whether there is any hemorrhage or calcification. Here we can see all the vessels are here, and those vessels are containing blood and those are giving signal void areas. And this one, finally, it's diffusion-weighted image. This one is important to assess whether there is any area which is having restriction of diffusion. If we have any area of diffusion restriction, we will see as a bright area here. We will have to compare with the ADC for making sure that the true restriction is there or not. So I will talk about those things in detail in the later videos. Thanks for watching this type of important videos. If you want to get more, then please subscribe and stay with us. Thank you very much.